Typhoid diagnosis and treatment.
Good afternoon, I'm Margarita Paragua.
I'm Susanna Paragua.
I'm Leah Wargo.
I'm Katie O'Hara.
I'm Mitra Sivakumar.
I'm John Ramos.
And I'm Cindy Kai. We are Typhoid Diagnosis and Treatment. Typhoid is a bacterial infection caused by the bacteria Salmonella typhi. Humans are the only viable host for this bacteria. Typhoid can spread through contaminated food or water, and poor sanitation and hygiene can also contribute to the spread of this disease. Our team focuses on the diagnosis and treatment of typhoid.
Alright, so there are three main diagnostic methods that doctors can use in order to diagnose whether or not somebody has typhoid. The first one, and perhaps the most effective one, is called a blood culture test. Using a patient's blood, a doctor can determine its contents from within. If any quantity of Salmonella typhi, which is the bacteria found in typhoid, then the diagnosis is positive. However, the problem here is that this test is expensive to administer due to the high costs of required materials. However, there are two other tests which involve either urine or stool. The problem here is that most patients would often feel uncomfortable and even embarrassed due to them believing it's a violation of their privacy.
An accurate diagnosis is fundamental for ensuring a patient's well-being and providing the proper treatment they need. However, an incorrect diagnosis can lead to severe or even fatal consequences. A false positive, which is where a patient is wrongly diagnosed with a condition that they don't actually have, can lead to bacterial resistance, which can prove future typhoid medications to be futile.
Seeking healthcare. Most often, typhoid fever first presents with mild symptoms, including mild fever and fatigue. However, these symptoms may cause some individuals to believe they can minimize the symptoms on their own as they are unaware of the bacterial presence. As the presence of the disease prolongs, symptoms become more severe, including high, constant fever, abdominal pain, and possible intestinal perforation. These symptoms are life-threatening. Therefore, healthcare workers strongly emphasize seeking healthcare within the first week of symptoms, as this allows for the most accurate diagnosis and care promptly. However, some individuals may not have access to healthcare due to their diplomatic or financial status, or believe typhoid fever is a chronic condition, therefore refuse treatment.
Currently, antibiotics are used to treat typhoid. Supportive care is also used, which includes proper nutrition and hydration, rest, and antipyretics. However, there are several limiting factors contributing to one's inability to receive proper treatment. For example, environmental factors such as living in a remote area or facing extreme weather, as well as economic and unemployment hardships, make it extremely difficult for many to receive treatment. However, for those that can receive treatment, it is vital that the full treatment plan is completed. Participating in the full treatment plan ensures that the bacteria is fully removed, the bacteria does not become resistant to the antibiotics, and the bacteria is not further spread to other people.
Our team's workshops will be focusing on educating the adults in the community and ensuring that they are aware of the treatments for typhoid fever and how it is diagnosed. The True and False game will bring awareness of false ideas and beliefs regarding typhoid, while our diagnosing activity will help the community know more about the process of diagnosing typhoid that they might experience with their doctor, so that in all, they are more likely to seek healthcare, be it for themselves or for their children.
So our first activity we have is a true and false game in hopes of debunking any common misconceptions that community members may have against typhoid. So the game will have 10 questions in 10 to 15 minutes depending on the facilitator and how fast he or she decides to go. The facilitator will go through a slideshow that we have prepared and go through the results of the statements as they go. As for the participants, if they want to indicate whether they believe the statement to be true, they can indicate that with a thumbs up, or if they believe that the statement is false, they can indicate that with a thumbs down. So some examples of the statements that we have are that typhoid is incurable. This statement is false because typhoid, with the right treatment, is definitely curable. Another example is that inconsistent treatment can cure typhoid. This statement is also false. because treatment should be consistent in order to completely get rid of the bacteria. Some more examples are that urine samples can be tested for typhoid. This example is true. Along with blood and stool samples, urine is a great indicator of whether or not an individual has typhoid. Finally, we have that blood tests are the rarest to administer. This statement is true as well. Due to the high cost of blood tests, not everyone is able to afford it.
Our second exercise is a typhoid diagnosing activity. There are 4 scenarios intended to take around 20 minutes total. For this activity, the facilitator will read scenarios about a patient experiencing symptoms and help guide the audience through various questions. These questions may include, is the patient showing signs of typhoid? Should the patient seek health care? And what steps should the patient take to ensure proper recovery? The purpose of this activity is to help educate people, specifically adults and parents, on the signs of health care or of typhoid, what the diagnosis looks like, and the treatment needed.
There are 3 resources that will be provided to community members: a handout, a flyer, and refreshments. The handout is a pamphlet that goes over all the basics of a typhoid appointment so that they can better understand the whole process. The flyer, with a flyer, information and support towards receiving health care is more easily accessible towards members of the community, such as those that may not have been able to attend the workshop. And finally, refreshments keep participants engaged and comfortable during the activities. This is the first page of the pamphlet, Typhoid Fever Guide to Your Appointment. We mention leadership initiative as well as urge anyone who is feeling unwell to seek medical care. The second page has common questions that doctors may ask, common treatments and tests for typhoid, such as blood culture and antibiotics. Once this is handed out, the facilitator will explain the contents of the pamphlet. With the flyer advises anyone who suspects they may have typhoid to seek medical attention. If they are unsure what typhoid may look like, it lists common symptoms so that they are more informed towards the disease. Thank you so much for your time. Are there any questions?